So I said on the blog like earlier that I had like been with my preceptor and my patient and like really helped me.
Yeah.
So since then, I haven't really advertised to like anyone else in the workplace because it's like a fast-paced environment, and there are certain situations where for example, at the end of every shift, I usually have 4 patients per shift, and then like at 7 p.m. when the nurses who are working from 7 a.m. to 7 p.m. to 7 a.m. come in, they come into you and you tell them like the patient's history and like what and like what had happened during the day, and like just like their vital signs, things like that. And it's like a quick thing, and because like they have to go get meds and you have to leave, it's like this quick paced kind of thing, and it's a different nurse every time. So like I kind of toyed the idea of like advertising during that, and I was like, I'm gonna advertise like next time, but then like it always happens and it's always quick and I don't. And usually when I'm doing it, like my stuttering is pretty like mild, just because like I have a list and I'm running through stuff and like I don't know. But there have been times when the nurses are kind of like, it's like I'm saying something and then they can tell it like hypertension, of like kind of like hypertension, like to complete the word for me. And I don't really know how to react. I'm just like, yeah, and then I like go on with it, and that like feels bad, but I don't like want to stop, and it's like all the nurses around, and like it just I don't know. So and then I walk out, and I if I had a really good day, and I'll like be happy about that, but then like when that happens, I'll walk out and be like, oh, it's like she thinks I'm like really nervous about something, or like didn't know about the patient, or like I'm not like well trained, and I think all these things in my head that could be erased if I just had like advertised to her. But I keep like telling myself to advertise to them, but I don't, because like I just get, I don't know, like it's a lot of stuff, and I'm like, oh, like she's waiting for me, and like it's a rush, and like she has to go to her patients, and I like just run through all the stuff.
So what ideally would you want to do in that situation? So you said now you had it, and you like walk away feeling like crap a little bit.
Yeah. I did like in that ideal situation, like we'd sit down and I'd be like, I'm Roisin, because sometimes the first time that I've met this person. At this point now, I think I've met everyone, but I haven't like talked to everyone, all the nurses who work on the floor. But like I'm like, hi, I'm Roisin, and like just so you know, I stutter. So if you like need me to repeat something or like reiterate something, just that's totally fine, and then I just go ahead with the report.
Okay.
And it's easy, and it's could totally make time for that. Yeah.
You have it like scripted what you want to say.
Yeah. I mean, I like planned to do it like 3 or 4 times. I just haven't actually taken any action to make it happen.
Right. You feel because of the time pressure.
The time pressure.
You're saying, oh, they don't really have time for this.
Yeah, and there's like other people around, and it's not like a formal like sit down and have a conversation. It's like you're running back from your computer, and you're like going over all this information, like all these papers, and like
in the hallway.
It's basically an excuse, but that's basically what that is. But it's like just another reason for me like to like be like, oh, I don't have time for that.
Yeah. I have as much time as I need, versus feeling like the time pressure and they don't have time for this and there's so much to do, but I have as much time as I need, I can do this, and then think about how you're going to feel after.
Yeah.
So remember too, like I think we've talked about this with the courage and how it grows from doing things versus like I'm going to wait until I have enough courage to do that.
Right.
Did you walk away from that stressed out and not feeling good because of the situation, because specifically because of your fluency or the amount of stuttering or control you had or didn't have over your speech?
For me, it was more like thinking about the future. In terms of, like, this stuff is going to happen.
Through that.
Yeah, and this stuff is going to, like, happen.
Right.
And like, it wasn't, like, in terms of what actually happened, it wasn't that bad.
Okay.
But how I felt afterwards, I was like, am I going to feel like this, like, repeatedly? With this job, or, like, with any job that I'm going to have nursing in a hospital, is that, like, since you work with so many different people, it's like I probably talk, like, in conversation about a patient with, like, 10 different people a shift, which is like
a lot.
It's opposed to other jobs, like you maybe have like 3 or 4 people, and like that's your like crew. That like I really have to do a lot more advertising than I'm doing. Obviously, I thought like my preceptor would be like, oh cool, I did that, like that's cool. But like there's so many other people that I have to.
You're having so many interactions with people. Which is really, in the long run, a fabulous opportunity of getting more and more, because you're facing a lot right now. Even though this is like, you know, you're having to deal with a lot because a lot's getting thrown at you, you're facing it, and it's gonna get easier.